It's two campuses of acute care. One is for women and children, that's in our Metairie campus in a suburban area of New Orleans, and the other's downtown, which you're in, is for really complex adult care. And then we have 30 clinics located all over the city. So about 300 acute care beds, and we have about 50,000 emergency room visits a year between the two campuses. We have about 220,000 clinic visits, and then in any particular day we have just north of 200 people that are in the hospital for inpatient care. Yeah, so we're an academic medical center, so we do everything. So since we're affiliated with a medical school, that means the medical students need education in all of it, so we do it all. But yes, we do have particular areas of expertise. Tulane is really well known for neuroscience, so both neurosurgery and neurology, for cancer care, we call that oncology, for cardiology and in particular advanced cardiac interventions. We have one of the region's only coronary total occlusion programs here where we can open up coronary arteries that are totally blocked off. We have a bone marrow transplant unit here. We have an abdominal transplant center here. We have a dedicated women's and children's hospital. We have a Tulane Institute for Sports Medicine, which is part of a orthopedic program. We're the only Elite Gold Plus American Heart Association Center for Stroke in the state, so that's part of our neuroscience program. It means that you've got world-class experts right here in your own town, and our doctors literally have people travel from all over the U.S. and from other countries routinely to come here for care. And so if you happen to live in New Orleans and you need that kind of quaternary care at an academic medical center, we've got it right here for you. We're a private hospital for our faculty, and our faculty rotate to both the VA facilities as well as the charity facilities. The name of the new charity hospital is University Medical Center, which is just down the street from us, and it opened in August. And so since it opened, there are a lot of patients that are unfunded that used to come to our emergency room that now go to their emergency room, which is a good thing for all involved, because the folks at University Medical Center get reimbursed for those charity patients under the state's reimbursement system versus we do not here. That challenge was taken up by our faculty and frankly our partnership between the university and HCA, and we just, like I said, we became a safety net hospital for this city until it could kind of get back on its feet again. And so there was an interim LSU hospital during a lot of that decade that slowly grew. It literally was intense at first, then it was in an old Lord & Taylor shopping center, and then it got into a refurbished old hospital, and now it's finally in the new charity, the University Medical Center, brand new building, $1.2 billion investment that the state made. So folks in this community have a great place to go that are either indigent or underinsured. That's a fantastic facility for them. It's been a positive effect for us because patients that previously did not qualify for Medicaid now can qualify for Medicaid with the governor's promise to expand Medicaid in our community. So that hasn't actually happened yet, but the governor has made that promise, our new governor, Governor Edwards. And then the other thing it's done is it's created exchange programs in the state where they can buy insurance on a private exchange for a lot cheaper than they used to be able to do it. And so we have seen our number of uninsured patients go down as a result of the affordability of buying the product on the exchange.